professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with the joint faculty appointment with the Ross University School of Medicine. And a lot of what I'm going to be talking about today within this article is how you fuse kind of on the ground work that is at the community level or within neighborhoods. Usually, so I want to first clear up some terminology. So when we're talking about neighborhoods, a lot of times that and community are used interchangeably. And so when you're using the neighborhood social cohesion a measure, this is something that is the naming is different according to even other countries, because in other countries community health work is very much a part of the healthcare system. Another point here to make is that global health uses different terminology than health within the United States. So let's go into further a couple of highlights. And of course, when I'm looking at an article, I actually like to see some highlights. And I actually happen to work with one of the individuals that works with Dr. Zonderman at the National Institute on Aging, Dr. Bedoun. And so this is actually an article that is interesting to me as well, because of the fact that I know some of these people. Looking at the methodology that was used, this is a very robust methodology, healthy aging in neighborhoods of diversity across the lifespan study handles. And this is cross-sectionally examining the association between neighborhood social cohesion and awareness of three chronic conditions. And yes, I know everybody will say usually that if we know everything that there is to know about diabetes, and I've heard this time and time again, but this is a topic area that I've developed over the years, and there's a lot of different components to diabetes that many people are not aware of, and through collective research, there's a lot of connections, for instance, with overall mortality, just the complications, the disease process. I've witnessed it firsthand within my clinical experiences. So chronic kidney disease and hypertension are the other two chronic conditions that are applied. And of course, along with that is self-management behaviors. And so can't ignore, of course, healthy eating, physical inactivity, and cigarette avoidance. These are physical behaviors, but a lot of these actually are coming with social ramifications, which not all the time we're able to unravel. And so looking at this neighborhood social cohesion, it's important to see what types of on the ground, boots level interventions are being made. Again, if we combine kidney disease, diabetes, and hypertension together, then this actually affects millions of people. And of course, many of these chronic diseases, because of the National Institute of Aging within NIMH, this is actually something that is studied in connection with Alzheimer's disease. Anyway, moving along to the U.S. Department of Health and Human Services and their definition of social cohesion. It's a major component to maintaining individual health, in part due to recent work examining the potential impact of neighborhood social cohesion on individual health outcomes. Um, Social cohesion is important. A network of social cohesion. A lot of times, this is difficult due to the rarity of the disease. For instance, I've I myself have a condition that only affects 1% of the population. These types of community level interventions um, is being redefined, I would argue, uh, with social media. Whereas the definition of a community was only within the context of the local surroundings, now neighborhood and community can be defined as virtual communities. I think that's if that's not considered within a publication, that might be an area which is a weakness and could be built further. Um, they looked at actually the data from the Chicago Health and Aging Project, and that was demonstrating that higher NSC, neighborhood social cohesion, was associated with decreased stroke mortality, but not stroke incidence, and was protective among whites, but not African Americans. Neighborhood social cohesion does not necessarily affect equally and has actually racial differences. And so, from an African American perspective, social cohesion may not be as effective. And again, it's important to note what social cohesion is. Um, and I know firsthand also from some individuals talking about nursing homes and how these individuals did not have anyone to visit them during the pandemic. And so because of the restrictions, that was difficult. Um, I'm highlighting some of the major projects and sources of data sets that you can access. And so Chicago Health and Aging Project is one, multi-ethnic study of atherosclerosis is another. These are different types of data sets which you can access. And it's important to have a data set which is all inclusive, leveraging a biracial cohort of socioeconomically diverse community dwelling adults. So again, I want to redefine the context of community and also provide how we can reach communities in multiple ways. And of course, the geospatial route in defining community is different than providing community level interventions. And each can complement each other. And it's a matter of understanding what is in practice versus what is being implicated. Um, and sometimes there's a disconnect. For instance, there might be a need from a geospatial analysis we find out within a county. There might be a need for more healthcare because the healthcare utilization is very low. So access to healthcare, we determine from geospatial means that it's needed. But the interventions that are being made are the ones that are being funded by grants and other types of funding, and they're competitive based on the companies and foundations that are willing to fund these, rather than looking at the actual needs through either geospatial epidemiology or more robust mechanisms. Rather than looking at the need, oftentimes there's a disconnect. Trying to provide the connection between funding for interventions, and then on the other hand, looking for identifying need. And needs-based assessments are also wonderful ways to integrate that, but there's some sort of framework that's needed. And of course, your spatial framework is one good approach. Even Healthy People 2030 is another wonderful approach to be using to implement within communities. Um, so when we're looking at data collection, people in my neighborhood are willing to help their neighbors, and a lot of these questions are provided in the National Health and Nutrition Examination Survey. I live in a close-knit neighborhood. People in my neighborhood can be trusted. People in my neighborhood generally do not get along with each other. People in my neighborhood do not share the same values. Um, and I think again, neighborhood is needs to be again defined in broader terms. Of course, now with the metaverse, there's additional component to understand, and consistent with prior research, a composite neighborhood social cohesion score was calculated as the mean of 5 items, with items 4 and 5 reverse coded, with higher values representing more agreement than there was social cohesion. Um, so these were the data collection mechanisms. Awareness outcomes included awareness of kidney disease, diabetes, and hypertension, defined by accurate self-report. So this is what sometimes there's recall bias here because self-reported information people oftentimes forget. But these are like kidney disease, diabetes. These are conditions that the general population is well aware of. So it's not as vulnerable to recall bias than a more rare disease, for instance, like sickle cell disease or some other disease which is not as common. Behavioral outcomes were defined by self-reported participation in healthy behaviors. And the health literacy test that was taken was measured with the test of functional health literacy in adults. And I think one other thing always I look at, because health literacy and diabetes health literacy was one of my first places that I wrote my master's thesis on. And so this was very, very important to me. And using a cutoff score is oftentimes especially important to make note of when you're thinking of composite measures. Um, so this goes on to understanding social cohesion in different contexts, neighborhood social cohesion, and awareness of chronic diseases, and neighborhood social cohesion and healthy behaviors. Um, so what's the point of all this? Neighborhood social cohesion and two potential mechanisms by which it could affect cardiovascular outcomes: awareness of chronic disease and engagement in healthy self-management behaviors. Um, there was really no association between neighborhood social cohesion and individual awareness of chronic diseases, overall or by race, which is a novel contribution to the literature. Um, Higher neighborhood social cohesion is associated with higher individual engagement in self-management behaviors. And so this would be talking about a more built environment, and the environmental surroundings, which would be interesting to combine with virtual communities, and how that amplifies and provides social cohesion. Um, so here are the references, and this provides um, some more articles which you can look at. But what are the key points that I want you to get from this? Well, I would like for you to take a look at all the data sets that were identified within the paper, and then also look at the health literacy that was a measure that was used. And then take a look at, of course, data was used, but take a look at the odds ratios and confidence intervals as well. These are always good to look at as practice for understanding the directionality of odds ratio. Um, so when we're thinking about albumin creatinine ratio, and of course that is a measure of renal failure, then you're thinking about um, how it's amplified by certain behavioral characteristics. And this is a good way to provide this. Seems like many of these were not necessarily statistically significant, but among African Americans, age was statistically significant, gender, high school graduate or above, so education, poverty level, regular provider for healthcare and diabetes diagnosis were all associated with cigarette use. Um, Now, when it among among whites, there were other, for instance, neighborhood social cohesion actually made an impact among whites in age, and high school graduate or above education and poverty level. So many of these were in common, but for some reason, regular provider for healthcare and diabetes diagnosis did not end up being significant. So then, in healthy eating, the same. You can interpret these in a similar way. And so I'm going to just wrap up here. Effective glomerular filtration rate, urine albumin creatinine ratio. These are all important parts. Um, so that sums up what this article is all about, and provides some contextual understanding how neighborhood social cohesion is differentially affecting different subpopulations. And I think it's important to understand that, and then also understanding how networks of social media can amplify this. Thank you for listening.